Hello everyone. Those who know me, it's fine. Those who don't, hi, I'm Dr. Swati Mittal Agarwal, an advanced aesthetic injector and an anti-aging specialist. A lot of people ask me, Doctor, which is the best Botox to use? Today, I'm going to answer this. I always tell my patient, Botox is just not one single product. Many patients believe that Botox injections are all the same. There are many variants in it. Botox injections comes in various brands and formulations. They all relax the muscles, but they behave slightly different inside the body. I have seen patients getting anxious after googling the names and all. That confusion happens because the difference is rarely explained properly. I have spent over 10 years in medical aesthetics, focusing on the facial anatomy and muscle dynamics. Botox is not just about removing lines and wrinkles, it's about understanding how the muscles work together. That's why choosing the right type of Botox injection is always personalized. Let's start with Botox, the original formulation. This is the most used and worldwide used Botox formulation, which got an approval in 2002. FDA approval, the first FDA approved injection is the original Botox Botox, which actually is botulinum toxin A, type A. I usually prefer this for the first time patients because the results are precise, predictable and very natural results. It works beautifully for forehead lines, frown lines and crow's feet. If you want subtle improvements without your face looking frozen, then this is my first choice. Next is Dysport. Dysport is the second type of Botox. It got the FDA approval after the Botox in 2007. Dysport spreads a little more than the original Botox. Because of this, it works well on the larger areas, especially with forehead, with patients which have a larger muscle bulk. I often use Dysport for patients with very expressive faces, but precision matters. Then is Xeonin. This is a clean Botox. It does not contain accessory proteins. Xeonin becomes important for the patients who have been getting Botox for very long years and they feel that their results do not last long. Xeonin helps to reduce the chance of resistance of Botox, which is developed over a period of time. Nabota. The next is Nabota. Nabota is another formulation that is becoming popular. It has a faster onset. It works slightly faster and patients usually see results within 2 to 3 days. This can be useful when the Botox injections are planned close to the event. Also hear the term baby Botox. Let me give you the baby Botox clarification. Baby Botox is not a separate Botox. It is a diluted form of Botox. It's a technique where we use Botox in a smaller doses for a preventive result. I often recommend this to the patients who want preventive results. Basically the patients who are in their late 20s or early 30s. How I choose Botox for my patients. I see their age, muscle strength, facial symmetry, and the results the patient is looking for. Whether they want a softer, subtle look or they want a frozen, dramatic look. Pricing reality check for Botox. Let me tell all my patients, Botox is not a cheap product. It is FDA approved. It is temperature regulated, should be kept properly and tightly packed. If pricing sounds unrealistically low, then check for the quality, the preservation, how it is kept, the aesthetic injector's experience, and you should really check it before getting it done. My advice is simple. Don't go to a clinic checking the Botox brand names. Go to the clinic asking for natural, subtle results. A good Botox injection should make you look rested and confident and not dramatic and treated. Thank you for watching. So, before getting a Botox injection, a proper consultation should always be done.